Wegovy tablets in the UK, what to know and discuss with your GP or pharmacist. Before we get started, this video is general information only. We will not be covering specific dosing instructions, how to take this medicine, or any administration details. Your exact instructions must come from your prescriber or pharmacist and from the patient information leaflet that comes with your medication. Nothing in this video should be used to start, stop, or change any medicine. Right, with that said, let's talk about the Wegovy tablet. If you've seen headlines about Wegovy now being available as a tablet in the UK, you're probably curious about what that actually means. So here's a helpful overview of what this medication is, why it exists, and, most importantly, what to discuss with your GP or pharmacist. Wegovy tablets contain semaglutide, the same active ingredient as the Wegovy injection. It's a GLP-1 receptor agonist, which means it works by mimicking a hormone involved in appetite regulation. The tablet formulation was approved by the MHRA in June 2026 for eligible adults living with obesity or adults who are overweight and have at least one weight-related health condition. Now, one thing worth knowing, and this is important, is that the tablet and the injection are not the same thing. They're absorbed differently by the body, and the dosing schedules are completely separate. So if you're currently on the injection and wondering about switching, that is a conversation you need to have with your prescriber. It's not a straightforward swap, and it should never be done without clinical supervision. What we can say generally is that oral semaglutide follows a gradual clinician-directed escalation. The dose starts low and increases over time. This isn't something to rush or self-adjust. It's a carefully structured process designed to help your body adapt and to reduce the risk of side effects like nausea, vomiting, or digestive discomfort, which are common at the start of treatment. How you take the tablet also matters a great deal, but the specifics of that need to come from your prescriber or pharmacist and from your patient information leaflet. What we will say is that the administration rules for this medication are precise, and following them correctly directly affects how well it works. So please do read that leaflet carefully and ask your pharmacist if anything is unclear. If you ever miss a dose or your treatment is interrupted for any reason, don't try to adjust things yourself. Contact your prescriber or pharmacist for guidance. And if you experience any new or worsening symptoms at any point during treatment, get in touch with a healthcare professional promptly. So, what should you actually be discussing with your GP or pharmacist? Here are a few good starting points. Ask whether you're eligible for the tablet formulation and what the plan looks like for you personally. If you're taking other medications, make sure your prescriber or pharmacist knows. There are timing considerations with this medicine that could affect other oral treatments. If you've had tolerability issues with the injection in the past, mention that too. And if you have any concerns about side effects or how treatment is going, raise them early rather than making changes on your own. As always, everything here is general information for UK audiences. Please speak to your GP or pharmacist for advice tailored to your individual circumstances, and always follow the guidance in your UK patient information leaflet. If you found this helpful, give it a like and subscribe to the Bolt Pharmacy channel for more medically reviewed health content. And if you have questions, drop them in the comments. We'd love to hear from you.